everyone, and welcome to Convos from the Couch by LifeStance Health. I'm Nikki Lienza, and on today's episode, I'll be talking with our Chief Medical Officer, Dr. Anisha Patel-Dunn, and our Executive Clinical Director, BreAnna Talley, about the importance of perinatal mental health. So welcome. Great to see you both on today.
Thanks. Great to see you again.
Yeah. Thanks, Nikki.
Dr. Patel-Dunn, tell us a little bit about what you do for LifeStance.
Sure. So thank you for having me. Anisha Patel-Dunn. So I live here in the East Bay of San Francisco, and I've been a practicing psychiatrist. I started my training in 2002 and have always had a special interest in women's mental health. So it's always been something that I focused on here, and really, especially this perinatal period is so critical. So I'm really excited to be talking about that.
Thank you. And BreAnna, tell us a little bit about you.
Sure. I started in the field about 2009, and perinatal mood and anxiety disorders have always been a hot topic for me. During my master's program, it was a focus of a proposed business plan I put together, where I ran through all the stats and really understood what the need was in our communities. So.
Great. And, I think that's such a key point there, just what a need for it, to talk and to have this discussion. And in fact, that brings me to a statistic I found. Per the National Library of Medicine, so just looking at the United States, 1 in 7 pregnant and perinatal women suffer from anxiety and depression. And we find that only half of these women actually seek mental health care. Mainly what's keeping them away from seeking mental health care is the stigma or just poor awareness of mental health. So I think that just emphasizes the need for this conversation too.
So absolutely. We had the most recent stat I could find was about 3.6 million births in the United States alone every year.
Wow.
So if we look at that, we're looking somewhere between 700,000 women with perinatal mood and anxiety disorder issues. And if only half of them are getting treatment, 350,000 women not being treated annually.
Right. So when you put it that way, it's like, wow, just hearing that number.
Right.
So BreAnna, tell us, can you start us off by telling us what perinatal, easy for me to say, perinatal mental health is and why is it important?
Sure. Well, there's a variety of facets to it. Some of it is preparing for childbirth. Some of it is during the pregnancy period. And then, of course, in the postpartum period. And I think most of us hear about postpartum depression.
Yeah.
But there's a whole variety of mood and anxiety disorders that can be exacerbated or have a first episode during that perinatal period. So the most common one we hear is about depression, which is very, very important. But there's also, anxiety, there's OCD flare-ups, and then, of course, the one that everyone's afraid of, postpartum psychosis.
Yeah. Sure. Dr. Patel-Dunn, anything you'd like to add to that?
Yeah, sure. I think generally speaking to the pregnancy period, and then it's usually considered up to 1 year after. So I think that, just thinking about not forgetting about our moms who even may be just managing here right after delivery, but that they can really have some sequelae up to 1 year after is how we sort of think about it. And then absolutely in thinking about, some of the most severe is that, untreated, even a postpartum, untreated depression or anxiety can also even lead to postpartum psychosis is what, we generally call it, where it can be very scary for both mother and loved ones around, as well as, worrisome for the infant and the baby.
And I think you both bring up such a good point of like, it's looking at this period of time, it's more than, it can manifest more than just depression. It can be these others of anxiety, even OCD or psychosis and stuff. And Dr. Patel-Dunn, you making note of that, it could be up until a year after. And I think that's another misnomer that maybe people don't recognize, that it can last much longer than just maybe a few weeks after maybe giving birth or something like that. So I think both are very key points. Yeah.
I think to add to that, just to clarify, it's not that it may last up until then. It could start 10 months after delivery, 11 months after delivery, right?
Good points. Very good.
And so that's an important piece. We're not screening new moms well enough. And so it's been pretty exciting to see the changes in the field. But one of the things that I had suggested in my business plan so many years ago was, where do moms go with new babies? They don't go take care of themselves anymore, but they go to the pediatrician with that baby, right? So, screening them with perinatal mood and anxiety disorder screeners at the pediatrician's office is a way to catch them, and that has actually started happening some. And I know that LifeStance is trying to partner with those pediatrician offices. But the piece that I think is important to mention here is that it's actually very important to treat mom and or dad, right?
Right.
This could be occurring with the father as well. It's important to treat them because if we don't, it increases the risk for diabetes, for a whole host of conditions for the child, right? And so when we don't treat mom, it turns into lifelong chronic health conditions for the child.
Okay. Dr. Patel-Dunn, anything you'd like to add to that?
Yeah, no, I think it is so critical that it impacts the whole family unit, right? So making sure that we think about, mom, but also the partner, other caretakers that are, closely involved at home. I do think too, the universal screening is something that, we are also in some areas trying to partner with OBGYN. So we know moms go in, after delivery for a check with their OBGYN. And then you're right, as Bree says, the pediatric appointments are very regular and scheduled. And so there are ways that if we can catch this, really early intervention is so important. It's so critical for bonding of mother and child and, all caretakers really at home and child. But then the impact of, a mom who may be suffering really does show long-term, problems with the child. So it's so critical, sort of early intervention.
Yeah, that's the key for sure.
And one thing that I just want to note, for my moms that have come to me that maybe have always, have been contemplating having a child and they have a pre-existing anxiety or depression, those are our moms that are most vulnerable, that the prevalence is higher in them for having some postpartum anxiety or depression when they have kind of periods in their life. And I think that's something that even just, women out there to recognize and to know, but that's something that's so important that I love to have the partner and the mom before delivery, just to talk about, here are some signs and symptoms, really just thinking about anything unusual. Obviously, when the baby comes home, there's a lot of sleep deprivation. But when you're able to sleep and you're not sleeping, that's I think sleep is such a critical part here, regardless of the anxiety or the depression. And so any changes in behavior of mom, but also making sure that we're getting mom her sleep. And if she's not, we need to address that very quickly.
Very true.
Yeah, I'd love to just piggyback on that, Anisha. I've got so many times I've partnered with different OBGYN clinics and either helped consult with them on, some of the new mom classes that they attend prior to delivery, or actually go in and do a presentation in one of those for them on the importance of sleep and working with their partners or with, potential family members that may be able to come over and assist, they have to get sleep. They're not, they're not a computer. They're not a robot. They're a human being. And just because baby is awake all the time doesn't mean that mom doesn't still need solid sleep. And that is definitely one of the first things that we look at when someone does come through to us for a postpartum or even perinatal condition is how much sleep are you getting? And so one of the best ways to prevent that is to ensure that they have a sleep plan ahead of time. Who's going to sleep when, right? So who's working? What time are they working? Who's going to be sleeping at what time? Do we need additional support from family, friends, caregivers to come in and care for the baby at some point so mom can get regular sleep? Especially if they have a pre-existing condition, it's so much more likely to trigger another episode or exacerbate their condition.
And I love that because it's being proactive on how to tackle it and how to navigate that. And I don't know if people necessarily think to do that. So I love that idea of the sleep plan. It's a great idea. What other symptoms might manifest during this time or this period for women? Part of this question is it's a bit broad because it might be more tailored towards, is it anxiety, is it depression, but is there just general symptoms that we might see popping up during this time?
Yeah. So one thing I just want to note is for pregnant women, right? So we've been talking a little bit about the postpartum time period after delivery, but pregnancy for all women can be, anxiety provoking. And I think it's so important to just make note that, if at all, it's normal first time moms to not know the uncertainty of the unknown. I think that often we all come with our own personal childhood experiences of how we were raised and our own memories of that. And so I think it's just important to note that, if you are at all having any type of anxiety or, concern about what's pregnancy going to hold after delivery, what is it that, what kind of mom you're going to be like, what kind of parent, reach out, get some therapy. It can be so helpful, especially in that time period. And so the message here of it's so easy to just, get in for some therapy to really talk through some stuff. And that also can be preventative in that then you've got a connection with the therapist, regardless of how long you're seeing. So just wanted to make note of that.
Oh, great.
That's a really great point, Anisha. And could you also talk a little bit about patients that are already taking medication for bipolar, for major depressive disorder, generalized anxiety disorder, what I know there's a lot of concern, right, around, or can we take Tylenol? Can we take Zyrtec, right? And so when it comes to our prescribed medications, people tend to get a little bit more anxious just about the medication. So love to hear a little about that.
Yeah, absolutely. And I think that that's something also conversations I often have in focusing in this area myself with my patients over the years is that, it's really important if you are taking medication to have those conversations with your psychiatrist, with your primary care clinician, your OBGYN. There are definitely, especially with the antidepressants, that the continuing on to take them during this time period can be really protective in preventing against the sequelae of postpartum, as we talk about depression, anxiety, and even the psychosis that can come. And there are certain illnesses, that we've seen. And then you talked about bipolar as well. So, depression, bipolar, where it is something that I very much encourage people to have a conversation with their clinician who's prescribing the medication, as that's such a critical time. And that, for some people, it may make sense to stop if they're doing well and they want to, for whatever reason. But I do think for a lot of women, it's really, giving them permission to take medication that's going to be, helpful for them, and really looking at the class of how the FDA classifies these medications. And one website that I think womensmentalhealth.org is a website through Mass General. They do a wonderful job, both for clinicians as well as moms, on just questions around pregnancy, breastfeeding, post, that whole time period. And so I do think there are also certainly medications that are considered less risk. So that, for example, for bipolar, depending on what medication you're on, you may consider changing to something else that may be less of a risk. And it's always a, risk benefit kind of discussion that I think is so important to have, and to make note too. And I just wanted a little bit, because I feel like I find myself with a lot of my moms with the breastfeeding, that sometimes they feel so much guilt. And especially when someone's really struggling with postpartum, some of that is they're really trying. And, I do think there's a lot of benefits to being breastfed. But I always share this with my patients, because for me, who I was born in the 70s and actually was premature and ended up in the NICU for 4 weeks before I got to go home after delivery. And so I was not breastfed. And so the reason I share that is I definitely think there is very much of a benefit of being breastfed, but sometimes it is so difficult for the mom. It's really impacting mood, anxiety, and just so to give people permission, our moms, that sometimes that your mental health is very important, and you can still have that bonding with your baby in a lot of different ways. And that's also something for our dads and partners, other partners that, will be there, that, being able to hold the baby, have time feeding, whether that's however that is, that there's just important that after delivery, it feels like the baby is just so dependent on the mother. And so then I think the partner can also feel a sense of, inadequacy, as low, sense of low self-esteem, because they feel helpless and hopeless, so to speak, because they can't do anything, they feel like, and it's not true. So, and also remembering, like, there are great things that need to be done, right? Like getting food, doing laundry, running the dishwasher, washing the dishes. And so I think that's something that people always feel like, the caretakers around the mom and baby is so critical too for mental well-being.
And I'm glad you brought that up, because I agree. It's so critical. BreAnna, anything you'd like to add to that?
No, that was great. The whole rundown was wonderful. Nikki, you asked a little bit ago about what are some of the signs and symptoms that people may see that are maybe specific to that postpartum period, and not just, typical depression or anxiety presentation. One of the ones that I see frequently is the mom feels guilty because they don't feel a connection to the baby, right? So they feel like, I'm supposed to be bonded to the baby. I'm supposed to love the baby. Every time the baby cries, I'm angry, right? Every time the baby cries, I'm sad, I'm upset. When the baby's happy, I feel nothing. It's not supposed to be this way. I'm a bad mother because of these things, right? Those are some, things that women are even afraid to talk about and tell other people, because they don't want other people to know that they're not perfect or that they're struggling, especially when, they're attending moms groups, which are great for support. But the other moms are going, oh, I feel this and I feel that and I feel the other thing. And the mom who's depressed or anxious is sitting there going, I don't feel any of these things. What's wrong with me? And that whole mindset tends to just even worsen the depression and anxiety. So obviously sleep is one, change in appetite is one. Those are sometimes hard to delineate between what the needs are of the baby and our healing bodies, right? So but those are also, part of the signs and symptoms. One that I really want to mention that is a hot topic is postpartum OCD, right? So most of us are pretty familiar with, OCD and, the obsessions and the compulsions that go along with it. But there's some very specific ones with postpartum OCD that are super important to screen our patients about, because they frequently won't tell anyone. They're afraid that they're developing postpartum psychosis. And the reason for that is they're having intrusive thoughts and intrusive images of either the baby getting hurt, maybe of them accidentally hurting the baby, purposefully hurting the baby. And so those are thoughts that they don't like. They don't identify with them, but they're afraid to tell anyone for fear that someone's going to take their baby away and put them in the hospital. Right? And so that's one that's really important to screen for. The prevalence is about 5% of new moms, develop a postpartum OCD. And so if it's a fear of harm based OCD, you'll see some of those things I just discussed with the intrusive thoughts and images. If it's a fear of contamination type OCD, you're going to see really obsessive behaviors around sterilizing everything, to the point where they're unable to function, they're unable to sleep because they're sterilizing everything constantly all day long, right? And so those are just a couple of pieces. There are some more things that go along with it, but those are a couple of the ones that I've seen most frequently in my work with moms. And so I always screen the new moms and gently ask them, are you experiencing any of these things? It may sound strange to you that I'm asking this question, but sometimes people are afraid to tell us. I'm not going to put you in the hospital if you tell me that you're having this thought or this image is popping in your head, and you don't like it, you don't want it there, right? But I can't help you if you don't tell me what it is and what's going on.
And I think that brings us to, what can women do to help with these symptoms? And I think that number one piece is speak up, share. Yeah. And I think a lot of the fear of that, like you mentioned, Bree, if it is something along the lines of intrusive thoughts of harm, they're going to be hesitant to share that, for fear that the baby will be taken away. But I think that's step one of what women can do is to speak up. Are there others that either of you would recommend of how women can navigate their symptoms?
Yes. So one thing I wanted to make note too is think people in there can be huge hormonal shifts right after delivery. And so as we think about symptoms and time period, to recognize, those first few days to even up to 2 weeks after, you can have, just mood and anxiety changes because of the hormonal shifts. And so just to recognize, wanting to kind of normalize women's experience, that there may be times, where you're crying often, you're not sleeping, you're irritable, et cetera. But really, if that's going on 2 weeks after delivery, that's really one of those, like, if you're going to remember one thing, the symptoms, if that's happening for longer than that relative time period, it's really important that, just reach out for help. And help can be different things, right? So definitely, therapy can be really helpful here, psychotherapy. And so reaching out, and then, even if medication, talking to your OBGYN, getting, a referral to see a psychiatric clinician, it just doesn't hurt to even just have an evaluation to be considered for. There may be medications that you can use as needed, or even, just there are antidepressant medications for anxiety and depression that, are used for a specific amount of time, 6 months to a year, that can be really helpful. So, and I know that that's just sort of those things to kind of mention. And then I do actually, as we talk about this, want to recognize that for, for women that really are suffering, that, a lot of women do get help and a lot of women do take medication and have therapy. And so it's okay. It really is okay. And so just to emphasize that.
Yeah. And, that's a good point. So maybe even finding some support groups of other women who are in treatment, right? Because you're not alone, and finding a support group is one way to really feel that and experience that. And hearing other women's experiences, you can develop a bond and help each other through that situation. You mentioned about if it lasts longer than 2 weeks after delivery. Can you talk a little bit, Anisha, about the length of time after you discontinue breastfeeding?
Yeah. Great question. So that's another time, actually, Bree, thanks for bringing that up, because that's such a vulnerable time for women too. And I actually want to pause and recognize that some women may breastfeed after 1 year. So as we think about the perinatal period, relative speaking, it's up to 1 year. I do want to mention that for women that do breastfeed, and whenever that time is that they may wean, that is also a very sensitive time. And that may be weaning because it's something you have decided, or your baby may decide that they're done. And so regardless, that can be a conflicting time for people, for our moms, and also to recognize there can be hormonal shifts at that time as well. And so that even, right after for some I've seen even several weeks after, but, a few weeks after, recognizing that there may be a time period where you feel, low mood, and kind of blue or sad. And so to recognize that maybe if that lasts longer than just, a week or two, to have a conversation with your clinician, reach out, to a therapist. We're here at LifeStance, happy to help you. But, reach out to a psychiatric clinician if you're struggling. But just to know that can come up. And if it's longer than, or if it's just feeling really strong, like it's impacting your ability to function, it may be bringing up other things for you. And so it's also a critical, vulnerable time. So thanks for mentioning that, Bree.
Yeah, it's such an important period we often overlook, and the woman is usually kind of on her own when she stops breastfeeding, right? So it can be a very isolating time period, in addition to those hormonal shifts, can trigger things. So another one to watch out for. With that being said, there's a lot of adjustments that occur just to becoming a new parent, whether it's the first time or it's the third or the fifth time. Every single time is different, and there's new stressors, there's life changes that occur, and with that change in sleep and in regular schedule, perinatal mood and anxiety disorders are not just about the birthing mother, right? So the father, the spouse, the partner, if you're adopting, right, this can affect adoptive families as well. And so, yes, the hormonal part is a very large piece of it, but sometimes it's more about that adjustment in what's happening in our life, and the massive changes that occur when we bring a new human being into the world that's fully and 100% dependent on you. Right? So I want to make sure that we mention that there are support groups not just for the birthing mothers. There are support groups for the spouses, for the partners, for the fathers, for adoptive parents, because this is a huge transition time, and because of that, it can exacerbate all kinds of mood and anxiety disorders. So just wanted to make sure we mention that as well.
Oh, I definitely appreciate you mentioning that, Bree, because it is very important as well. And so as we wind down, any other takeaways you would like to share about the importance of perinatal mental health? Any other points that you want to highlight?
Yeah, just two things actually. One, there is a medication approved for postpartum depression, Zulresso, brexanolone. That is an IV infusion that has to be given over. I think it's actually, sorry, I'm totally blanking on this, but I believe it's over 30 hours. And so it is something that actually can be very helpful, very effective, very quickly. But there are some limitations on how it's administered, but it is something we at LifeStance in Oklahoma, actually, we are administering that in a very thoughtful way. And I think it's something that is out there in other areas too, but that there's just, I think that that's something that sometimes comes up in the media and on the news, is that the FDA approved medication. I believe that was approved in 2019. It's just been difficult to, because of the IV infusion requirement over a significant amount of time. I may have to look that up. It's over, I think, a 3-day period we're doing that. So, and then the other thing I'm always wanting to, message is if you're ever in doubt of if you're suffering, just reach out for an evaluation. So easy to get online, schedule an appointment, reach out to oftentimes your primary care clinician, your OBGYN, your pediatrician can help you navigate that. It's so important to just, get in and get help.
And I think the greatest thing that we've got going in the last few years is the advent of telehealth for this particular condition, right? Because sometimes it's really difficult to travel with new baby, with the family. And so telehealth opens up that access to care. Don't necessarily have to leave the house. You can have psychotherapy and medication evaluations from your home. And so that's really important, I think, to note, as well as, there's support groups and everything else that are online now. So if travel with baby is difficult for you, no fear, LifeStance is here.
Right. Oh, great line right there.
Just want to make sure I don't quote. It's 60 hours. It's an IV brexanolone, which is Zulresso, is a IV infusion over 60 hours. So anyway.
It's not continuous 60, right?
It is continuous over a 60-hour period. You dose
so they stay overnight?
Doses. Yeah, they do.
Okay.
They do. Yeah. Yeah. So anyway, just wanted
clarification.
Yes. Sorry about that. Just wanted to clarify that.
And Bree, I love that. No fear, LifeStance is here. I think that's a great tagline. That's great. Well, I want to thank you both for your time and sharing all your knowledge about this really important topic today. I think our listeners, our viewers are definitely going to gather a lot of knowledge that they maybe weren't clear about. And I think the focus here is really reaching out, get some help. You're not in this alone. Get the support you need. So once again, thank you both.
Thank you so much, Nikki.
Thank you.